being a provider that has an established office, if you were in conversation with a provider who was fresh out of dental school and maybe pondering the question of where do I go from here, what would be your advice to them?
I'm seeing a lot of the graduates that are coming out of school, they're not wanting to be practice owners. I would say it's a slim margin that do, and the ones that do are, I think they're being told some things that are not really true. The expectations are set so high with, you have professors telling you things in school like, hey, when you get out, you should do blah, 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 blah. But a lot of the times those professors are not working in private practice. They're working in a educational environment and they're just looking at numbers, right?
Sure.
So, going through dental school, it's an experience in itself. And one of the biggest things you learn is good work ethic, especially, falling back on what we're talking about, having a transient workforce. You have to be able to pick up the pieces when everything is not ideal. And mostly every day it's not going to be ideal. I don't care how good you think you are. Somebody's going to fall off the schedule or somebody's going to call out sick. I told my staff about a month ago, I said, listen, I will give you guys a bonus if we can get everyone to work 2 straight weeks without being out. And it hasn't happened yet. And it's not because they're just calling out. People get sick, things happen. So with that being said, you have to be able to operate amidst of chaos, even though you don't create the chaos. You have to be able to still have the focus in mind and be a great leader and tell everyone, say, hey, listen, you have to pull in the same direction regardless of what's going on. And if you can communicate that to your staff and even to your patients, they're understanding. And that would be my biggest advice. Because a lot of them go to a lot of your corporations and which are fine, they're giving the security of the money, but after a while, they don't stay there long because they're still feeling that void of, hey, I want to have my own ownership. I want to, run things my way. And when you get on this side of it, it's a different ball game. You don't have the venture capitalist money behind you to just throw money at everything. Money doesn't solve all problems. So you have to get in and really dig in and make sure it's something you really want to do.
Find good mentors, whether that's a GPR or private practice. That I'll let them make their own choice on that. But I think you should learn to actually, be able to learn how to effectively communicate and sell the dentistry that you're actually recommending. Because if I'm not using sell in a bad term, sell means you're benefiting the patient. And it should always be the benefit of the patient. But if you can effectively communicate better, you're getting the patient healthier. You're also helping yourself too financially. And everyone's winning in those scenarios. So I think those are two things, and then you should learn insurance and actually how it works. A lot of little details that can go a long way with like making sure claims get approved and you don't get mad patients because the claim didn't get approved. And just learning how to handle when those problems do come up, because they will talk to you about it, even if you're the associate and have nothing to do with billing. They are going to mention it.
Be humble enough to realize that there's a lot to learn, a lot you can learn. And whether it's through conferences or just networking or just reading articles, just realize you can learn stuff from everything. But to the other side of that, don't assume just because the guy's been out longer than you that he knows anything, because some people haven't pushed themselves for the last couple of decades. And so it's not about comparing yourself to whoever's across the parking lot or across town, but it's how can we be better and how can we look at who else is around and who can you learn from and just pursuing your goals no matter where you're at, because if you're young and you're ambitious and you want to learn, there's a lot of opportunities out there in the right spot. Then again, I'm also really lucky that I'm in a town that isn't competitive. If it was Southern California or Colorado where I used to practice, I wouldn't own my own practice right now. So it's finding a place that you feel comfortable being, figuring out what goals are realistic, and you got to make compromises in life. Although I haven't had to make a ton, but just realizing like you're not better than anybody, but if you work hard, you can be better than people who've been doing a lot longer than you.
The conditions on the ground for dental school grads, has changed a lot over the past like 20 years.
Yeah.
In a nutshell, you could just say it's kind of the same as it is for college grads, where the debt loads are very high for a lot of people, and the market dynamics have changed quite a bit. So I think, like with anything, I mean, this could be for dentists, this could be for grads in any profession or discipline, vocation, would be one, try to, as soon as you can, but don't rush it, figure out what it is that you like doing. Because if you were talking dentistry as a category or business or whatever, like these are very broad categories. Dentistry sounds like it's pretty specific, and it is in some sense, but it's also very broad.
Right.
And so figuring out what it is that you like to do, and that could mean, one, clinically, like, do you like doing extractions or not? Do you like doing root canals or not? I mean, you don't have to do everything. And figuring out what you do like doing so that you can focus your efforts on that, and really train yourself and specialize and refine will give you, I think, a lot more enjoyment in your day-to-day. And it'll also help guide you in terms of what kind of day-to-day work you're seeking out. Whether that's practice ownership or whether you don't necessarily want to go down that road and you want to do more of an associateship. And I've done both. They both have their merits. But I think, like, let's say you wanted to own a practice, but you wanted to clinically to do A, B, and C, but not D. You would be I think you'd have more enjoyment being an associate, but doing the type of clinical stuff you want to do versus being a practice owner where you got to do all the stuff that you don't want to do.
Yeah.
So really just figuring out what it is that you want to do. And then the other thing, which kind of ties into that, is try to find good mentors. I was really fortunate that I kind of had a lot of those built in because of the familial connection. But find good mentors, because you're not necessarily going to copy them. But if you can kind of pick out all the things that they do that you really find to be effective or just in sync with how you do things, that's going to give you an accelerated development process. So you can kind of get to that point of, I don't think we ever truly arrive, but you kind of get to that level of like, okay, I'm very proficient in what I'm doing. And that's where it becomes a little less stressful and a lot more fun.
Honestly, and I can only really speak for myself, and Christine, feel free to jump in whenever, but I find that especially nowadays, when you graduate school, you are so fixated on the dollar amount of what you owe. I mean, you spent 4 years racking up all this debt, and everybody knows dental school is not cheap by any means. So you tend to fixate so much on the money aspect, trying to make money and this and that. I would probably advise a new graduate to kind of take a step back, try not to focus on the money. The money will come. Rather, try to find a office that can, somewhere where you don't have to compromise your ethics, essentially.
And your values.
And your values. And find somewhere where you can find the mentorship that will allow you to ultimately reach those goals, because there are so many more important things than money. And the money will eventually come. You just need to be patient about it and just really focus on building your skills and your ethics and, working in an environment where you can foster those relationships that we talked about earlier, and building that rapport and, focusing on all that, because when you're working in a high volume environment, you really don't have the time to develop those social skills that you develop with patients. You just don't. And so I think you lose a lot of that. And then when you do that for a couple of years and then you switch over to a private practice model, that disconnect is very obvious and patients can feel it. So
yeah. And just to remember, like, keep in mind why you went into the field to begin with, because most of us did this to help care for others and provide healthcare. And basically overall health and wellness is at the forefront of why we do this. Yeah. So just keep that in mind and don't let the other things kind of cloud your judgment in pursuing certain jobs.
Yeah.